Good afternoon. Welcome back to Monday Motivation with my good friend, Dr. Serena H. Chen, a colleague of mine from IRMS in Livingston, New Jersey. I'm Alice Crisci, co-founder and CEO of Medanswers, creator of the Fertility Answers app platform. Now, there's seemingly nothing else going on in the world right now beyond coronavirus. We know this, right? It has become pretty difficult to go about life as usual when never in our lifetimes, I don't think, Serena, have you or I ever seen whole cities in different countries locked down. I mean, we've seen containment for Ebola. We've seen containment, we've seen pregnant women leave cities to protect pregnancies from Zika. We've never witnessed something like this before.
So, I hate to say never, but I remember vaguely SARS and MERS and it didn't really come over here, right?
It
So it
didn't.
wasn't
Yeah, we felt
really,
so protected.
yeah, it seemed like some big news far away. And now people are really feeling it here, although there's a lot of reassuring data in the United States, despite the fact that they are identifying more cases and they are doing more travel restrictions. I think there's still a lot of things that are reassuring about the situation in the United States. Now, I don't want to belittle what's going on at all, but I do think it is important to remember that healthy people, pregnant women, and children do not appear to be susceptible to getting a severe case of the virus. It looks like the deaths so far in the United States and have been people who are already very, very, very vulnerable to viruses anyway, which are the elderly with something we like to call comorbidities, which usually is stuff like you already have a chronic lung disease, you already
Like
have a bad
COPD
COPD,
or
right? Lung cancer.
exactly.
You're on chemotherapy. You
Right.
have heart failure. So really, if you have a serious underlying illness, it does increase your risk of death, honestly, from any infection, and coronavirus is no exception to that.
Now,
But
it does look
unlike
like your level of exposure though makes a difference too, because we do have healthy first responders who have succumbed to coronavirus. That seems to be more related, no underlying health conditions, to the level of exposure. When
massive
they've been
inoculation,
yes,
yes, massive
exactly.
inoculation,
Which
and
no average person would ever have that level of inoculation. Certainly not with whole festivals like South by Southwest being canceled. And those
right.
really big public environments where you could have just extreme amounts of
Right.
viral kind of passage from person to person. Now, I also was reading that that people aren't really showing symptoms until about 5 days after they've been exposed. Is
Right,
what I
but
read
I think a
recently.
lot of people get really crazy about that because they're just thinking everybody around them has cooties and they're going to get it. But the
Exactly.
thing is, when you're asymptomatic, you're not really shedding as much.
Yeah.
Okay,
Right.
remember, this virus can only attach to respiratory epithelium, which people get confused about. People think it's in the air and they're going to breathe it and then they're going to get sick. But what happens is when people cough or sneeze, if they're ill or they're shedding virus, the virus can live on surfaces for about a week. And we are touching surfaces all the
All the
time.
time.
And then we are touching our faces, and the ports of entry are the mouth, the nose, and the eyes, because the mucous membranes in the eyes are attached to the nose and eventually lead to the oropharynx. So this goes back to biology, how everything's connected there. So those are the ports of entry. That's how the virus gets to the respiratory epithelium. It doesn't go through your skin. You can't really breathe like somebody who's in another room, and then if you breathe the same air, it's not airborne.
Right.
Not
It's
airborne.
literally just leave your face alone. That's why washing your hands, makes such is the most important thing, and hand sanitizers out, but they say soap and water for 20 seconds is better
Honestly,
anyway.
soap and water is really the number one best way to sanitize your hands. Hand sanitizer is only helpful if you don't have good, easy access to a sink,
Sure.
right? And
Right.
soap,
Right.
soap. And we're seeing these crazy things where people are like just buying out all the hand sanitizer. Meanwhile, there's tons of soap in the stores.
Yes.
So
Right.
it it doesn't totally make sense. And this run in the grocery stores maybe is because the CDC told people at risk that they should be prepared to stay home. So if you have severe heart disease, the CDC doesn't want you going out. They want you to have
Of course.
your healthy relative or your healthy friend go to the grocery store for you instead of you going out. So there is some advice on the CDC website about making sure you have supplies to be able to stay at home if you are vulnerable to coronavirus, but not
Yeah.
really for people who are healthy. Okay.
Right.
So
Right.
this run on the grocery stores doesn't really make medical sense.